When you're in the ER, have you ever wondered who's helping make sure your medications are right, especially when seconds count?
Welcome to What Brings You In Today, a podcast from SGMC Health.
I'm Kara Hope Rockwell.
And I'm Erica Bennett. And today we're joined by Luke Saunders, who's a pharmacist at SGMC Health. So, Luke, what brings you in today?
Yeah, thanks for having me. Talking about inpatient pharmacy and how pharmacists interact with the care team in different parts of the hospital and maybe more specifically in the emergency department.
Very good. So to start, tell us a little bit about your career, how you landed at SGMC Health, and kind of your experience.
Yeah. So I started at SGMC Health about almost 8 years ago now. I started out working night shift after graduating in pharmacy school. I worked night shift for about 2.5 years. And when I was working there, we basically took care of all of the different patients in the hospital, took care of ICU patients, med-surg patients, ED patients, and with that, really kind of enjoyed kind of helping the higher acuity patients out a lot more. And so I got the opportunity to move into the ER about 4 years ago. And so I've been working as an ER pharmacist for that amount of time.
And doing a very good job, I might add, because I've been in several board meetings and committee meetings where your name has come up for different activities, initiatives that y'all are leading on to improve pharmaceutical care within the organization.
Thank you.
So that's one of the reasons we wanted to bring you on so you could share a little insight of what that looks like, because it's something that I don't think most patients or even a lot of employees might not understand how inpatient pharmacy truly impacts care that's being delivered.
I was going to say a lot of people might not even realize that pharmacists work in the hospital. So what's the difference in like a hospital inpatient pharmacist versus maybe the one that you see at a drugstore?
Yeah, it's true. Most of my colleagues work in the retail settings. They work in CVS, a Walgreens, a small independent pharmacy. But there's a pretty good amount of folks that are working in the inpatient setting. Here at SGMC Health, we have a lot of different pharmacy services that we provide. We have just our regular inpatient services. So those are, again, kind of servicing all the patients here in the hospital. We have some OR pharmacy services as well. So that's helping out anesthesiologists with making sure that different medications are available. We also have oncology pharmacists that work very closely with our oncologists to ensure that patients are receiving accurate doses of chemotherapy. We have our retail space, of course, and we have kind of staff and clinical folks as well that are really kind of oriented to very specific kind of subsections of the hospital, just like the emergency department, the ICU, and med-surg as well.
Mm-hmm. So let's talk about the emergency department. When you come into the emergency department, I feel like one of the first things they ask is kind of like, what kind of medications are you on as they're doing their assessment, and how important is it to know that in the clinical assessment of the patient? Yeah,
it's really helpful, if patients or care team members kind of have a good idea of what medications you're taking. Particular conditions can predispose patients to some possibly untoward, issues if they're on particular medications. Like, let's say that you come in with a fall and you're on a blood thinner. It's really important for us to know that you're on a blood thinning medication. Did you just finish some antibiotics? Did you, start a new medication recently and maybe you're coming in with some sort of allergic reaction? That bit of information is very helpful for us. So one thing that we always encourage patients is to try to keep an accurate medication list. We know that this can be very difficult to do, but the medium itself really doesn't matter. If you have a handwritten list, if you have something electronic within MyChart, if you bring all of your bottles in, that's great too. Or if you have a family member that keeps track of all of that, it's very, very helpful, I think, to have that information. We know that it can be very difficult to maintain. Some patients are on a lot of different medications. They have really long, confusing names, and so we definitely empathize with that, but having that information is very helpful to us. And when you do come into the hospital, that is something that we as pharmacists will look at. We'll make sure that list is accurate. And then when you go home, that is something that we're kind of cleaning up as well. So each time that you encounter kind of our healthcare system, that medication list is revised and kind of cleaned up as well.
So what we refer to as that medication reconciliation.
Yeah, exactly, yeah.
How often do you see patients on, like, drugs that are either just not necessary because they're either doing the same thing or counterproductive just because like over the years they've started taking them and never really had them assessed again?
Yeah, pretty often. We definitely have a lot of patients that come in maybe with just some old information, and that could be information pulled in from another hospital that we had, and so that's where I think our job really helps to clarify a lot of that information. I think physicians and nurses are very busy, trying to work up patients, and so to have a care team member kind of specifically dedicated toward those medications is really important. I think being able to provide accurate information for the care team is very important, very helpful.
So what does a typical day look like for you as a pharmacist in the ER?
It's hard to say. So there are
Different every day,
no
I'm
2
sure.
days that are similar in the emergency department. But that's part of why I like it, I think, is there's a lot of variety. For me, when I get to work, I normally will kind of go around and figure out kind of who may require, the most amount of kind of medication intervention, who are the sickest patients there. So I'm reviewing their chart and making sure that, the medications are dosed appropriately. Trying to look back at old cultures just to see if, there's anything there, if we need to escalate antibiotics or maybe we can come down on them as well. Also, looking at the drips, making sure everything is programmed correctly is a big intervention that I do. The other thing that I do as well is kind of follow up on cultures when they go home from the emergency department. So let's say that you come in with, complaints of like a urinary tract infection, and we're sending your urine to the lab. I'm making sure that you're discharged on appropriate antibiotics. That's one thing that I look at as well. I kind of work on some projects and things, and then I'm helping out with any emergent conditions that come in. So, anything, any cardiac arrest, any trauma, any intubation, like I'm in the room helping draw up medications. And so it varies a lot. There's not really a set schedule, I guess, that I have, but that's part of the fun of it. So,
Speaking of the urinary tract infection and the antibiotic usage in those cases, tell us a little bit about that project that y'all did, because I found that like fascinating that y'all are able to like target our specific area and population and basically deliver a more appropriate antibiotic for not a disease but a
Infection?
condition.
yeah, for sure. So when I first started in the emergency department, that was kind of one of my bigger interventions, was kind of following up on those cultures. And I noticed that when we were prescribing a particular antibiotic, it seems like we had to switch therapy a whole bunch. That particular antibiotic we were using just didn't seem to be super effective. And I remember fielding a number of questions from some of our ER physicians like, hey, how well does this particular medication work for, a young female with urinary complaints or something? And so the natural thing is to go to our hospital antibiogram, which is kind of a fancy name for it. Just basically says like, how well do our antibiotics do against the organisms that we have in the hospital? For us, looking at that, it's good information, but it aggregates data from blood cultures, from urine cultures, from wound cultures. Basically, it kind of aggregates all of this data and spits it out. But the question that I always ask is more specifically, how well does this particular antibiotic work against, someone who has a urinary tract infection? And so I got with our good folks over in the microbiology department, and I got really specific data that would kind of show us that essentially. And so we were able to create these weighted averages and basically make recommendations of what antibiotics work most effectively against the most commonly occurring organisms. Every place is a little bit different. If you look at some of the guidelines for antibiotics, they're fantastic and they're good for guidelines, but they, have hospital information from all over the country, from all over the world as well. And so we know that, here in South Georgia or wherever you're at, everybody's a little bit different. And so, one thing with that particular intervention is we were actually able to reduce the amount of times that we called patients and had to change antibiotics. Normally when they go home, we send them home with an antibiotic and they're sitting at home, hopefully taking that antibiotic, but we don't really know how well that antibiotic is performing until about 72 hours later. So there's a lag time there. With that being said, we're able to get not only specific data for main campus, but also for the Lanier, Berrien, and Smith Northview campuses as well. So you don't have to come to the big hospital in order to get adequate care. We got very specific information for those campuses as well. and they kind of have their own antibiotic recommendations, which actually aren't that different from main campus. But that was something that we wanted to make sure of, is that wherever you go within our health system, you're getting the best care possible. So
That's fascinating.
Yeah, it's so cool. Just to be able to do that, to localize that, and to be able to do that research and that background. And I mean, you just wouldn't assume that our professionals are back there doing that. You just kind of think, oh, you're distributing medication based on whatever the guidelines are. So I thought that was really unique and really cool. So commend that entire team for their work on that.
And obviously, medication safety is a really big deal for patients and their families. How does the pharmacy team help prevent medication errors?
Yeah. For me, particularly in the emergency department, it can be somewhat of a chaotic environment at times. It's controlled chaos. Everybody, has kind of been in those situations before, but there's not always time to triple check and quadruple check some of these things. And so for me, when we have a trauma come in or something, I'm getting medications that we anticipate that we would use. And these are medications that I feel really comfortable with. It's medications that we use every single day. And so one of the nice things I think about having a pharmacist on the care team is the ability for the physicians kind of to cognitively offload a lot of their thoughts. They can focus on diagnoses, they can focus on, treatments or procedures, things like that. They don't necessarily have to worry about, medications and how they're dosed and things like that. Obviously, that takes a lot of rapport to get there with the physicians, but, they can look at me and say, hey, I want this particular medication for this patient. And being in the room, I have the appropriate context for how we would use that particular medication. I know why we're using it, and can kind of prepare that medication in its most ready-made form. So when I'm giving the medication to the nurse, they can feel confident. They can go ahead and give it. It's not like a big package that they have to undo and prepare themselves. It's something that I've already prepared, and they go ahead and give it. So that's a really nice thing that we do, particularly in the emergency department. I will say, throughout the hospital, we have pharmacists everywhere. We have pharmacists in the ICU, med-surg. We have some in central pharmacy. And any time that a physician orders something, for you in the hospital, it's reviewed by a pharmacist. When the pharmacist is reviewing it, they're looking at your home medication list. They're making sure that the new medications that are ordered are not going to interact at all with the things that you're taking at home. They're making sure that things are dosed appropriately. They're making sure that the context makes sense for whatever you're receiving. And they're also making recommendations for maybe altering therapy as well. Sometimes when an electrolyte value comes back abnormally, or, maybe you have a positive blood culture and you need to be started on an antibiotic, those are alerts that these pharmacists will get and that we can be able to action or act upon them very quickly. So we do a lot of quality assurance here in the hospital. I think our role is very important, I think, in ensuring that patients really get the best care here. Again, people are very busy, but I think having care members that are, very focused on medication safety is very important. So,
this question just came to mind. If you are an inpatient and you have medications that you take daily, do you still have to take your external medications that you already had while you're in the hospital, or does the inpatient care team kind of overtake that based on what the information they provided when they came in?
Yeah, so that's why having like a accurate medication list is really important. So if that's something that a pharmacist can provide, that essentially gives that to the physician. They then can go through and figure out what medications need to be continued. Sometimes when patients are in the hospital, they can have certain conditions that maybe resuming something at home may not be appropriate. Maybe something they're taking at home is actually the reason why they're here in the hospital. And so those are something that it's very situation dependent, but I think having all of the information available and having accurate information really helps that physician kind of go through things, resume things, being able to determine maybe they need to be started on something that they're not on, or discontinue something that they've been taking as well. So.
How do you talk about medication names with patients? Like, some of them have, very long, hard to pronounce names, and that's not what we know them by as the general public. But how do you educate people on, this is this medication, here's why you're taking it?
Yeah, it can be sometimes a little tricky for pharmacists too. I know some of these newer medications can have some kind of crazy names, so we definitely understand it. But I think that's the great thing about hospital pharmacy is we're kind of uniquely positioned to be able to counsel patients because we have the context of why these patients are being prescribed these antibiotics. Our retail colleagues, like, pharmacists who are working at a small independent or one of the chains, they essentially receive a prescription maybe for an antibiotic, but it's not always clear why they're on that antibiotic. They essentially just kind of have that hard copy in their hands. And so it can be difficult for them to kind of counsel patients because we don't always know why they're taking it. Hospital pharmacists, I think, are, again, kind of in a good role to be able to understand why patients are being discharged on particular medications. Maybe they've been in the hospital a few days and one pharmacist has been kind of following their care throughout that time. That I think clears up a lot of why, patients get put on these different medications and hopefully prevents a lot of representations to the, emergency department. I think if you can really help patients understand why they're taking a particular medication, it helps kind of mitigate a lot of, maybe untoward side effects. It reiterates the importance of these particular medications, and I think ultimately, positively affects their care.
We recently had an event where we had someone speaking to some members of our team about like opioid prescription and usage and how she actually had a family member that ended up passing away over time after becoming addicted to opioids after a hospital stay. Now, this was 10 years ago, I think, that happened. But her concern was that there was not enough like communication about that particular drug and how it would impact his care. Have you seen more of that education in your world now that we're kind of more aware of how those are used and what the impacts could mean later on?
Yeah, definitely. So we have alerts built into our electronic medical record to review kind of what medications patients are already on that may kind of exacerbate, the drowsiness and things that may, patients may see with opioids, which is really important. We've also kind of made strides to reduce the quantities of some of the opioid prescriptions that we're sending. So we're really just kind of using these for acute pain until they can get plugged in with a primary care physician or maybe an orthopedist, depending on what's going on with those patients. And again, when I'm counseling patients in the emergency department, when they go home on these, I reiterate like, hey, these medications can really make you drowsy. No driving, no operating machinery. I'll throw in a joke and say no skydiving, snowboarding, or whatever. But it is really important for patients to know, how drowsy it can make them. Again, I'm looking at some of the medications that you're taking at home just to make sure that new opioid prescription is not going to make things worse potentially. So I think we've really tried to make strides to ensure safety with those high-risk medications.
Yeah. That's good.
And that is one thing that she talked about, going home with 3 pills versus 30 pills. I mean, that makes a big difference
sure.
in your,
how you
likelihood
utilize it.
of getting addicted to it.
Yeah. Tell us about you a little bit. Like, what made you decide to become a pharmacist? How did you get into that career?
So I guess growing up, I had some family members and myself that kind of had some health issues, and so I remember actually having to take kind of a number of medications growing up, and so I kind of had this primitive interest of like, I wonder how I can like take this medication. It like makes me feel better. Like, how does the pill know where to go?
I always have that question.
Yes. How does the Tylenol where to go?
Yeah, how does it know? So I kind of had that primitive interest in it, and kind of growing up through school, I took high school chemistry, and I really loved kind of the chemistry aspect of it. And so I think kind of that primitive interest combined with, enjoying science and things like that, and of course wanting to help folks, pharmacy kind of made a natural fit. It's funny, when I went into pharmacy, I was very much okay with kind of helping patients from a distance. I didn't want to be like super hands-on. I was completely fine being behind a computer, and the ironic part is I'm very involved in the emergency department.
Yeah.
I love it though. I initially was very okay being, kind of cerebral and thinking about things, and now it's I'm a lot more hands-on, and so. I went off to college, and I knew I wanted to do pharmacy before going to college, which was nice. So I just did all the prerequisites for pharmacy school and got in and finished and found myself working in hospital pharmacy, which I really love. So
yeah, That's awesome. So now you got to tell us, how does the Tylenol know where to go? Like, you got to explain, or do we got to go to school to figure that out?
You have to go to school. It's proprietary information. No, the honest truth is it doesn't really know where to go.
Right.
So when it gets absorbed, it basically kind of goes throughout the body and is, looking for receptors that would accommodate that particular medication. And so, the truth is kind of like, you think like the pill knows where to go, but it doesn't.
Yeah.
Know where to go. It essentially just kind of gets dissolved and, is looking for
just hope it
receptors
works.
that would. Yeah, exactly. And then all of the downstream effects that you learn in pharmacy school and then probably put you guys to sleep and myself.
Do you have your friends and family call you all the time asking medication questions? Because I have a friend that's a pharmacist, and I have to say I do sometimes ask her, like, hey, what about this?
Yeah, on occasion I do. I think it tends to flare up during like flu season and things like that. I think kind of helping out with over-the-counter medications. And I actually really don't mind those questions at all. I think, for me, there are a lot of, there's so many products at the pharmacy that you can pick up, and it can be very overwhelming. And so I think trying to get some guidance through, trying to, I'm just trying to feel better kind of thing. Like, should I take this medication? I'm on all of these other medications at home. Can I take this cough and cold medication? And so I think that's really a way that I can kind of help family and friends out. And I really don't mind the questions, but I do get them on occasion. Yeah. So.
Do you have any particular incident of where you felt like, wow, I was able to like really help that patient, or any memorable patient experience that the pharmacy was able to impact their care?
Yeah, I can think of like a couple of close calls that we've prevented for sure. I know this was maybe about a year ago, but we had a little, like, this baby was like maybe less than 1 month old. We were trying to get kind of the baby comfortable, and we were in the process of drawing up a pain medication, and the nurse drew it up, and I was like, hey, what is that? And they told me the name of the medication, and I was like, oh, it's actually like 10 times the amount that we need to give to this kid. And so again, kind of in those really uncontrolled environments, like we always try to double check each other, and I'm just as prone to errors as anyone else. But, these medications are something that I'm pretty familiar with. And so I'm glad that, it's something that we always do, but, there have been some really big kind of catches that we've done. And, just to ensure that, patients are getting the absolute best care possible.
And that's what makes your role so important, to have pharmacists in there looking at that and that are attuned to that, because like a lot of those medications, they look alike, sound alike.
Yeah, for sure.
And it could be so easy to pull the wrong one.
Definitely, yeah.
Or the dosing, like you said, it's different for a baby than a child than an adult, and it could.
And I especially imagine that's harder in the emergency room, where time is like of the essence. You've got so many different things going on and unknown.
Yeah. Yeah, it can be. That's kind of the really nice thing I think about having a pharmacist there, is we have a very diverse group of patients that come in. We have these little bitty babies come in to, normal aged folks all the way up to, to older folks. And so, learning about how medications kind of behave in those different patient populations, I think is really good. I also think too, another one of the projects that we've worked on is, generally medications are kind of eliminated by your kidneys. And so when your kidneys aren't working very well, generally those medications tend to accumulate and can be really, really high levels in your body. There is kind of a particular subset of the population that when your kidneys actually can work really, really well, so like your body is basically just eliminating this medication quicker than you can actually get it to an effective concentration. And so we've really made strides to kind of identify those patients and dose those patients more appropriately, either with higher doses or more frequent doses. We also have ways of like drawing levels to make sure that we're actually getting those proper therapeutic levels. And so there are a whole bunch of different things that we can look at as pharmacists to make sure that, patients are not only getting the right medication, but it's also dosed appropriately as well. So,
And going to be effective on that particular patient based on their.
I've noticed on my 23andMe account, I did that, and they have a section about whether or not you're a rapid metabolizer of a certain drugs. Is that kind of the same thing?
Yeah, it is. Yeah, it's probably more to do with like liver metabolism, but there are some folks that, certain medications depending on how it's metabolized, can really go through.
Well, they
medications
also say
quickly
redheads and anesthesia.
Yeah.
There's some kind of thing
as
about
well.
that.
Yeah, I don't know,
Maybe
but
that's what they meant. They just
Could
took
be.
your red hair and marked you as that.
Probably.
maybe.
I
Yeah,
require more anesthesia. I'm harder to put to sleep.
yeah.
That is wild, though. It is wild that you can have such a variety of impact on different people.
Yeah.
Well, what are any misconceptions that people have about pharmacist medications in general that you've seen frequently that we could help dispel while we have the microphone?
Yeah.
I don't know about misconceptions necessarily. I'll tell you what I generally advocate for. I generally advocate for, when you go to the pharmacy, always pick up the generic. I think a lot of people are really tempted to go and buy brand name in particular. And I think for me, like, brand and generic are the exact same. It may not look as fancy, but you end up saving quite a bit of money when you get the generic at the drugstore versus the brand name. It's the same active ingredient. So I generally tend to encourage patients that direction as well. I don't know. I think, hospital pharmacists, again, are kind of, in the background. I would certainly encourage patients that when they're here, again, we're really trying to make sure that you get great care when you're here. I know it can be a very scary thing when, you look up and you see all the medications hanging on the pump and things like that, but you have a lot of really good folks that are looking after you. And so it's difficult because not every patient interacts with a hospital pharmacist. So there's this idea that if I don't see them, then maybe they don't exist. But we're really looking to make sure that you get great care here. So
I love that. I do have one more technical question, though, before we wrap up. Taking an antibiotic and taking it to completion.
Mm-hmm. Yeah.
Because it is so tempting to not finish that antibiotic.
It is.
When you start feeling better
Yeah.
after like day 2 or 3, you're like, I don't need to take the rest of this.
Yeah.
Speak for yourself, because I always want to finish it.
I don't. I'm kind of like, oh, okay, I'm good. I don't want to have to take that unnecessarily. But I hear that it's so bad for you.
It can be, yeah. Kind of the reason why we encourage patients to finish their antibiotic course, obviously, is to make sure that they're, getting all of the drug in their system that they need to hopefully eradicate an infection if it's there. But it's also kind of to mitigate a lot of the antibiotic resistance that can happen too. So if you're taking it for a short course and you don't finish the actual, medication itself, if that particular organism sticks around, it could actually develop resistance to that medication that you're taking, and then we have to switch antibiotics and things like that. And so
See, that makes me want to take
we
it.
do,
A
we
little
do
bit
in general,
more if I can understand
absolutely, finish those antibiotics. I will say, if there's ever a question, on whether or not you should finish, I would definitely reach out to your primary care doctor, whomever prescribes it, because there are some rare scenarios where it may be okay to stop after 3 to 5 days and things like that. But in general, we very much kind of encourage patients to finish that course and reach out if you're having side effects. I mean, that's probably the biggest reason why folks don't want to finish it is, I'm just starting to feel bad kind of thing. And so, there are other medications that we can possibly use to treat those side effects, or maybe we need to switch antibiotics, or, we would encourage like more yogurt intake or taking it with food, or maybe you should take it on an empty stomach. There are all kinds of different things that we can kind of modify, not necessarily with medications, that can hopefully help that course be a little bit easier. So
I thought of something else too. I read something recently that the United States is one of only like 2 countries in the world that has medication commercials like advertised on TV.
yeah.
What do you think about that? Just curious.
Yeah, I'm generally not a fan, I guess, of the commercial advertising of medications. Yeah. I understand that it's kind of a necessary part of the, research and development of a particular medication, but, a lot of money is spent toward medication advertising in general. I guess it's good to kind of get the word out about a new medication. I think that's kind of how we kind of understand how things are, but In general, like just because it's on the TV or it's advertised doesn't mean it's great for every patient.
Right.
Yeah.
I think
well,
that's kind of
obviously because
yeah.
they have to list those side effects, which
Yeah,
is like
you hear all the
likely
side effects,
death or
Every side effect possible.
Yeah.
it's like who would ever want to take that medication?
Yeah, it's
wild.
likely only applicable to a very, very small percent of the population, and so I don't know. It seems
Not
a
very
bit weird.
effective.
Yes.
Yeah, I mean, from a marketing perspective, to us, that's like wild, but
Yeah. Like you're going to go
Okay.
into the doctor and be like, hey, I saw this on TV. That's what I want.
Right. Yeah.
strange, but it is what it is.
Well, if there was one piece of advice you could give to patients or families to help, you provide the safest care possible, what would that be?
I think the biggest thing is asking questions. I think a lot of folks are pretty nervous to ask. I think you can make an argument that pharmacists really anywhere, particularly in the retail setting, are likely some of the most accessible healthcare providers. A lot of times you call the doctor's office and you're probably not going to get the doctor on the phone. Maybe it's hard to get a nurse on the phone too, but you show up at your local pharmacy and you can pretty readily get a pharmacist available. And so, with that, like obviously our training is more specific about medications, but we do have a little bit of education on, hey, maybe when you should go to the emergency department or when this particular issue that you're having is concerning. And so I think the biggest thing is asking questions. We talked about it earlier, but accurate medication lists are very important as well. I would try to fill all of your medications at one pharmacy if it's possible. It's not possible always with things like insurance and things, but it is a little bit easier when you get everything from one place because, that particular pharmacist has all of the information there. But yeah, accurate medication list and ask questions.
Mm-hmm. Good tips.
Yeah.
Just one final question. This is something we ask everybody that comes on the podcast.
Okay.
But what is your favorite meal to eat here at SGMC Health in the cafeteria or in the Spice?
Let's see. The salads honestly are pretty good. I do like the salads. I'll be honest, it very much depends on the shift in the emergency department. If it's a rough
You get
shift,
to eat it all.
sometimes I'm doing the chicken tenders, which are really good. I love the burgers. I think the burgers are quite nice, but it kind of depends on how the shift's going.
That makes total sense.
What I'm eating.
Are you saying you stressy?
It's been a really hard day. I need some chicken tenders.
Yeah.
I feel that.
I've said that before.
Yeah, definitely. All right. Well, we just want to thank you so much for coming on with us. I think we learned a lot, and I'm sure our listeners will too. And we just appreciate the role that y'all play in the success of our health system, but the health and wellness of our patients.
Yeah. Thanks for having me.
Appreciate
so
that.
much. Yeah.
And if you have any questions or topics you're interested in hearing about, you can let us know at sgmc.org/podcast. And don't forget to like and subscribe.